Good morning, everyone. My name is Jennifer Ibrahim. I have the pleasure of serving as the Dean of the College of Public Health and the School of Social Work. Happy National Public Health Week to everyone who is joining us. We are really delighted this morning that we have a bit of a local legend here. And given what is currently going on in the world related to public health and healthcare more broadly, we are very excited to have the commissioner speaking with us today. We will go through an interview style of conversation. I'll be asking some questions, but I also want to encourage active participation. So I would invite all of you as we are going back and forth with some preset questions. Please put your questions in the chat and then we will open it up for broader discussion at the end. So have those questions ready. I am sure there will be plenty of them. So without further ado, we welcome Dr. Palak Raval-Nelson, who is the Commissioner of Health for Philadelphia's Department of Public Health. She has been with the department since 1996, where she began her career as a public health sanitarian. So for many of our students who are on today, this is a great way for you to think about career trajectory. She has served in a range of different positions, from supervisor, manager, administrator. She was overseeing environmental health services. In terms of her background, she graduated with her doctorate in environmental health and policy from Drexel University. She has an MPH from Hahnemann University, and she is Temple made with an undergraduate biology degree here at Temple University. So I'm going to jump right in. And Dr. Raval-Nelson, thank you so much for joining us today. I will hand it off to you if you have any opening remarks, opening comments that you want to share with us. And then I shared some questions in advance and we'll get right to it. But I'll turn to you for any opening remarks.
Well, first of all, thank you so much, Dr. Ibrahim, and thank you for letting me, have this opportunity. It is humbling for me, to say the least, as a Temple alum, as a Temple undergrad who came to, Philadelphia to see Temple University when I was picking colleges, and instantly walked on Park Mall and fell in love with the campus. And it caused me to fall in love with Philadelphia. And I will say our tagline, Temple Owls are everywhere. We're everywhere. You never know where you're going to run into one of us. So it has been a journey. My Temple education has been something that I lean on and quite fondly think of as I work through this role. So
And I will also say some of you may have enjoyed class with Dr. Raval-Nelson because she also comes back and connects with the Owls. She has served as an adjunct faculty member for us. So again, like you said, owls are everywhere. So can we kick off and can you talk a little bit about some of your priorities coming into the position? And I will give the disclosure or the disclaimer that I sit as a member of the Board of Health for the City of Philadelphia. And so I have the opportunity to get to work closely with you. But can you share for everybody who's on the call today some of your priorities, some of the things that you are looking forward to working on?
sure, absolutely. One of the things, and I'll frame it in this context. Mayor Parker has, uh, you know, coined the phrase or is working on making Philadelphia the cleanest, greenest, safest, and economic access for economic opportunity for all city, right? Philadelphia is the poorest big city in our country. And all of those items that she's identified are all social determinants of public health, right? If we have clean spaces and places, and my passion, my background is within environmental public health, and so having the context of that in the background, the priorities of the health department are to look at the healthcare desert that we have in Northeast Philadelphia, and working to put the health centers, which this work was initiated many years ago prior to me taking this role. So getting those health centers in place, making sure that we are supporting our entire staff and dealing with the ebb and flows of the transitions that are happening at all levels of government right now, making sure that we are supportive, because I'm a firm believer that if staff are taken care of, they will then go do the good public health work. The other thing that is the underlying item for me is that you know, public health, when we're doing public health, no one knows we're there. It's seamless. No one thinks about, you turn on your water faucet, you go grab your cup of coffee, you take a breath in, breath out. No one thinks about, did somebody monitor the air quality? Did somebody make sure that my food was safe? Did somebody verify that the water that I'm drinking is okay? Did anybody verify that, children that are going into the schools are immunized? Did anybody check? So it is only when there are massive things like a pandemic or other things that people realize, right? When we do public health, we're so good at not bringing attention to ourselves that we're often not at the table. And I learned this as environmental health services director when I was working on special events and everything. So one of my goals, one of my priorities right now is to make sure that everybody recognizes the role while public health is under attack at all levels, that I know the administration and the city knows all about public health and we are so supported here, but that we are marketing ourselves well so that people understand the need for public health to be at the table and what potentially will happen if if we are not active in our pursuit to protect and defend public health right now.
So I think that's a great point. Can you say a little bit more about advice? We have some of our faculty, our staff, our students, some alumni who are joining us today. Um, what is your advice to be able to do that, to send a more powerful message? Because right now we're seeing the misinformation that's out there, whether we're talking about vaccinations, whether we're talking about ways to protect against infectious disease. What might your advice be to folks about ways that we can be more effective about promoting that?
Sure. I think honestly, we're at the core of us as public health practitioners. We're scientists at the core of us, right? And science relies on actual truth and and the facts. And so it doesn't have to be, we don't have to go and be boisterous or anything like that. But I think people, if nothing else, the pandemic created this network where people know what are the sources to go to. So at one point during the pandemic, we all knew if you got a text from 888, whatever the number was, that was about the pandemic, and that kind of spoke to what action you should take. So our what we're working on is really making sure that those trusted voices in the community or those trusted forms of communication are then provided proactive information. So just like with the stuff that happened with the measles, we had a very subtle but effective press release that we did that was factual, that was very simply stated. And that is the sort of thing that we're doing. So whether it's changes that are happening that are on the funding landscape or what have you, we are trying to be the trusted voices that people can go to and provide as immediate factual information as possible.
And so you mentioned the measles outbreak. Can you talk a little bit about not just what's being done here in Philadelphia, but we know when we're talking about infectious disease, and we saw some of this in the news with individuals who are flying from point A to point B. Can you talk a little bit, not just about Philadelphia, but the larger integrated across different health departments, across counties, ways that the health departments are connecting and working together to be prepared to respond to wherever the outbreak may be? Maybe talk a little bit, what are the what's going on in terms of data sharing, information sharing, that ongoing surveillance piece?
Sure. So we have, within the health department, we have our robust division of disease control who conducts the surveillance activities and monitoring throughout. We also have our networks with the Pennsylvania Department of Health and our local counties and municipalities within the state of Pennsylvania. We also have connections and communications with the Big Cities Coalition, with ASTA, with NACHO. So we're all collaborating and bonding. And under normal circumstances, those things would happen, at the CDC level and everything else. But because we've been actively woven in this intricate fabric of communication and public health, right? Because it's been so robust, those are the channels that we've been using to communicate and work with everybody. And I will say, unfortunately, or fortunately, because we're all in the same boat, those communication networks have been seamless, and we also work actively with the hospitals in the city. We have our 8 health centers. We have, academic institutions like Temple University and others. So we're just working on those kind of channels and those networks to get information out.
So we're talking about the measles, we're talking, and you had mentioned the CDC, so I'll go there. Can you talk a little bit about the way the health department is responding to some of the challenges that we're seeing coming out of the federal government right now, whether we're talking about, and I don't know if you could speak at all to, shifts in funding priorities, grants that may be ended, and what does that look like? What does that translate into in terms of impact for services that are being provided to Philadelphians? And then, what's on the horizon? What are ways that the city of Philadelphia is planning and protecting to promote or planning to protect and promote the health of Philadelphia moving forward?
Sure. So let me answer maybe the second part first, if I could. So I don't know if folks are aware, but the mayor is doing her budget town halls throughout the entire city. So she's very adamant about making sure that because Philadelphia is the city of neighborhoods, she is adamant about making sure that we in leadership are all there meeting with the community, so they're well aware of not only the demographics of the pockets of the neighborhood, but what the aggressive budget plan is. One of her biggest goals is housing and the home project. We know from a public health standpoint that if you have stable housing and stable employment, it again then speaks to all of the other social determinants of public health. So as a city, there's a proactive agenda in place that is being worked through the budget cycle. We are in budget mode right now. So that's that piece. As far as funding cuts or information from the federal government, our process is that when we are notified about something, we right away let our overall leadership and administration and the law department know. And we're taking everything. Again, there's a lot of misinformation out there, right? So if you're just looking at a news channel, or if you're just looking at a feed of sorts, but you're not on the internal side, we're actually getting the direct communication about a particular funding and funding source and what's happening, you're not going to know all of the information. And for us, as we need to make changes, we are going to communicate those out using the same frameworks, the trusted frameworks that we've had in place because of the pandemic and everything. And so that's going to be the process steps. And we're your health department. So if you have a question, if you have a concern, reach out, ask, right? Have that conversation. For me, assuming this role, I've been very hands-on throughout my career. And being in this elevated new role doesn't mean that hands-on style has changed. I get phone calls and emails and interactions from anybody and everybody that has a question.
So you mentioned Mayor Parker's priority with regards to housing, and so one of the things here at Temple, our students, our faculty, and staff are very engaged in the community, whether it's service learning initiatives or give back days or community engaged research projects. So one of the areas that we're really focused on is Kensington, and there is a major challenge both in terms of individuals who are experiencing housing displacement, but we also know there's significant challenges with regards to opioids. So can you talk a little bit about that? What are the plans moving forward? Have we seen progress in that regard? What are your thoughts there?
Sure. So there's been significant progress. There's a whole wellness ecosystem, and the health department is a part of it, but there's a whole, this is such an important initiative that it's being led by our managing director's office. And So, and I'm not sure if folks heard about the warming center project that we engaged in we've had the coldest winter in years in Philadelphia. And one of our biggest worries is about our unhoused population, whether it be in Kensington or it be in other parts of the city. And so we have, there was an initiative put forward to have warming centers, which were essentially sites during the day and at night. So during heat emergencies, we have cooling centers that are activated. And the thought with those is that if a person is in mechanical cooling or is cooled off their body temperature for, I believe it's 4 to 6 hours a day, then it's okay, they'll be fine. There won't be the concerns about heat stress and heat stroke. But with the cold temperatures, it's very challenging. You can't just do a SEPTA bus or a cooling center. We needed to provide a space for folks during the day and at night. And so we worked really diligently the first weekend of the year to create a warming center, upwards of over 20 throughout the entire city. And as health commissioner, that was one of the first projects that I got to work with our Department of Behavioral Health and our Office of Homeless Services and everything. And I will say, and our Office of Emergency Management, Parks and Recreation, the libraries, everybody came together. We had spaces and places for all of our unhoused populations. We had things in place for folks that were, still experiencing the symptoms of withdrawal that needed to come in, and it was all created, and we're doing after action plans for that. But separate in kind of conjunction, but separate from that is the Riverview Wellness Village and the wellness ecosystem, which is essentially designed to create opportunities for folks that are experiencing substance abuse to have a longer a place, to go after their initial treatment of 30 days.
So can you expand on that a little bit more? Because we also know, in addition to, that there are these comorbidities, and we understand that there's not just the substance use, and so it may be individuals who were attempting to manage chronic pain, or there may be an isolated incident, or maybe an ongoing issue. But we also know that we have individuals who are dealing with mental health issues, diagnosed or undiagnosed. So can you talk a little bit more about sort of because one of the things is, everyone who is on here today, we all use the public health lens, but we have individuals who are coming at these issues from social work, from nursing, from public health, from recreational therapy, occupational therapy. Can you talk a little bit about what are ways to be able to approach those when we have these comorbidities? You mentioned the disparities, but what about when we've got these really complex and complicated issues?
Sure. So one of the biggest, so I guess my style, I've been with city government for 29 years. So I have worked across departments. I've worked across, as things have come up, whether it's regulatory aspects of swimming pools at our recreation centers, or working with our prisons when we do inspections. So being in this new leadership role and understanding the need and the priority for cross collaboration and cross departmental collaboration. So our Department of DBH, IDS, Department of Behavioral and Intellectual Disabilities, they are a separate department. However, they're within our Health and Human Services cluster. And so we work seamlessly with them. We've, created these relationships where we have they have the number 988, where you can reach out to them, and they will send a mobile unit, and they will work on the mental health aspects, and then they will reach out and work with our Office of Homeless Services and the Department of Public Health as needed if there are other comorbidities and needs that present. So what was created initially, because of the warming centers, has now bloomed into these collaborative relationships that if and when we need something cross-sectionally to address comorbidities or other challenges that someone is having, we can very easily connect with each other and provide the most holistic, service that we can as a city government.
So when you're talking about the collaborations, one of the things that we know within government, within public health, that a lot of times we're challenged. We may have the best of intentions, we may have the best evidence, but we're limited by resources. You talked a little bit about being able to address the healthcare desert in North Philadelphia or Northeast Philadelphia. Can you talk a little bit about your approach with regards to prioritization and limited resources? We can't do everything. So can you talk a little bit about what your leadership, what your approach and your philosophy is in that regard?
No, absolutely. We can't do everything all at once. And the key there is all at once. And when we talk about resources, we know in public health that throwing money at a problem is not always the solution or the best solution. And so my approach has a lot to do with systems thinking and looking at, what is the problem, looking at it from who are the players that are trying to address this problem? Who does it touch? And where does it go? So building the internal, fortifying us internally as a department, having everybody know that, oh, this particular area of the department is working on this task and another division needs resources. Why not instead just join this other division or this group, and then we can have a more holistic approach and next steps. So we have our groups that are working on making sure that there's safe and healthy food at sites and that there are safe and healthy options, right? And when we have one division that's like, oh yes, let's push out this food and it'll be great and kids will like it and they'll eat it and they'll be nutritionally balanced, right? But then we realize that there have to be parameters in place for that food to be left out on a table. So case in point, strawberries. We know that there's a potential for E. coli, food poisoning in strawberries. So if we have one area that's saying, oh yes, let's buy strawberries, let's wash them, let's leave them on the table, let's let kids pick, but then we're not accounting for the food temperatures. We're not accounting for, is there a capacity to wash them properly and all of that. So we're really holistically, it'll be 5 months next month that I'll be commissioner. And so we're really holistically looking at all of our program areas, looking at all of our resources. I'm also very much of the mindset that the budget that we are entrusted with by, whether it's a granting agency or by the taxpayers of Philadelphia, we have to be mindful of making the most efficient use of that budget. And so it lends to a systems approach of looking at all of that. And I also value my 3 pillars of leadership are accountability, integrity, and commitment. So it's all, how do we use those to move the agenda forward to serve our most vulnerable Philadelphians, in the most efficient capacity.
So you've talked a bit about collaboration within the department. Can you talk about any examples that you could share or ideas that you have moving forward for where there may be opportunities for public-private partnerships, or we see academic health departments in other spaces in other states. Can you talk about what you see, any examples now, and then what you see as the future for those opportunities for collaboration to make those limited resources go as far as possible?
Sure. I mean, one of the opportunities and one of the kind of touch points is really our work, whether it's through the Board of Health and the Board of Health members, but that's not inclusive of, all of the partners everywhere. The other opportunities, the best example that I can probably give is our IRB process and engaging, and looking at it from an equity lens and engaging community organizations to be a part, so that so often when we're doing research, and we know this, there are populations that are excluded right? So if we have the LD levels, LD50 levels, when they do those tox tests, so often it's done on, what would happen if Caucasian males of a certain weight and height ingest this, and then they set the level based on that, which doesn't speak to women, to minorities, to kids. This is why we were in such a challenge with lead, where a lead level for an adult is way different. There is no safe level of lead, let me clarify, but versus a child, an infant that's growing. So having a more inclusive process and working with our academic partners through the IRB process. So recently I learned about Drexel's doing a community-based IRB approach with organizations. So we're going to work with them collaboratively to figure out for the health department's IRB, how can we work to bridge a gap? How can we work collaboratively to move that forward?
And can you touch on any opportunities for collaboration with private industry when we're seeing the potential for federal government, that those dollars may be diminishing? We know within the research communities, folks are shifting, looking not just at the federal government, starting to look more at foundations, looking at industry partnerships. Can you talk at all about what the health department is thinking in that regard, where there may be opportunities to work perhaps with some of the largest employers in Philadelphia?
Sure. So again, the door is open, and there's, folks are welcome to work with us and reach out, but we are actively working with the foundations in the city to look at what are the opportunities for funding that may be available to join partnerships and do, joint partnership work, whether it's around our space for our division of HIV health, our chronic injury prevention division, which focuses on, everything from gun violence to nutrition. So the other aspect of the health department that a lot of people don't think about is the regulatory aspect. So we also regulate, we issue permits. And so we have, permit holders like for air quality. We passed our air management services regulation several several years ago, I apologize, which regulates additional air toxins and what Title V permit holders can and cannot release. And so part of this is helping them and working with them to clarify things and come up with solutions that make sense from a regulatory aspect, so that we're not creating a situation where then industries are trying to leave the city, where we lose, resources and revenue that way.
Great, thank you. And so thank you for putting a question. I do want to open it up to everyone. You can either raise your hand and be able to unmute and answer your question or ask your question, or if you want to add questions into the chat. But Sol, great question. Next year we are looking at a major year for Philadelphia between the World Cup, our 250th birthday, and the All-Star game. So we know we are going to have a big year, lots of folks who are going to be coming into the area. Can you talk a little bit about preparation for that and doing that in the context, thinking about lessons that we learned from COVID-19, thinking about communicable disease? What do you see as some of the challenges, and what are the ways that the health department is preparing for that?
Sure, absolutely. And I don't know if people remember or not, but not that many years ago, we had the Pope here, and we had the Democratic National Convention here as well. So those were two major events, and on an annual basis, the city of Philadelphia puts together the Party on the Parkway, or the 4th of July celebrations, as the birthplace of liberty, as the cradle of liberty. We do a really great job. And, during the papal visit, it was a funny moment, because I was giving a talk, and one of the folks in the audience was a prior health commissioner that served in this role. And he came up to me afterwards and said, "Do you remember when we were planning for the papal visit and the Democratic National Convention at the same time? And do you remember what you said to me?" And I said, "I absolutely do not. That was so many years ago." And he said, "We're going to do this right, so no one gets a foodborne illness. and no one has any issues. And Commissioner, I just want you to know that there are going to be things that we're going to need to carry out that are going to be activities. Again, when we do public health, right, it is seamless, right? People don't know. And so it was very interesting and kind of humbling again to have been in that role for all of that planning. And we carried that out. There were no foodborne illnesses. There was no, it went seamlessly. And we were on that parkway. It was for, I think, 14 days, 17 days for the pre-planning and until the Pope left. Every single night, the team, whether it was our preparedness team, our OEM department, our environmental health services team, we were out there, our air management services team. So we know how to do the plans and all of that. So not only is the administration and city government has a whole litany of plans to make this, these events to be so amazing. Philadelphia is going to be so showcased and rightfully so, the amazing city that we are. But we have already begun all of our, planning and our preparedness team and the divisions and the cross-sectional work, and then also with cross-departmental work. So we are utilizing all of our lessons learned, our tools and our skill sets. Some of the items we know we can do differently and better because of the pandemic. One of the unintended positive consequences is that the use of technology, right? And how things have changed. So whether it's Zoom or Teams or other things, that it lends itself for us to be able to do more and do things more safely and put certain barriers and all of our activity and our planning with surveillance and all of the things that we learned, we have a more robust system in place.
So you touched on this a little bit, and I'm going to push a little bit more in terms of the emergency preparedness, having 5 or 6 games that are going to be here in Philadelphia, and now the push part is, will there be any opportunities for drills or practices, and are there opportunities for our students to get involved?
So we're always practicing. So there are always tabletops, and there are always, there are networks beyond networks that about, we have a plan A and then we have a plan B, C, D, and F. So we are always practicing. As far as students getting involved, I believe there are things that we can think about doing, and we can talk through about what are the interests and how we can potentially fold in. We have a lot of students that work with us. And I came up as the environmental health services director. So traditionally they hire about 11 students during the summer to do all sorts of things. So there are definitely opportunities, and we can touch on those and plan those out.
Wonderful. And we've got a couple of hands up. So I'll call on you, and then if you want to just unmute and ask your question, that's perfect. Samar.
Hi, thank you, Dr. Ibrahim. Hi, Dr. Nelson. Thank you so much for your time today. Really appreciate it. I wanted to ask, considering Philadelphia, has been consistently one of the largest cities with the highest poverty rates in the country that we have seen. And this has been a challenge for many decades now, further worsened by COVID-19 impacts. We are seeing federal grant freezes and anticipated cuts with lawsuits being filed. In terms of sustainability and adaptive strategies, what kind of long-term strategic planning is the city doing or has been to be a more agile city and to be more proactive in its approach so that, governments come and go, shifts take place in terms of being able to better serve the city and the people of Philadelphia? How is the city taking a more proactive approach given changes like this?
So that is an amazing, great question, and I thank you for that. This is one of the kind of most exciting times to be in city government, for me, at least in this role, given what I've seen of the mayor's budget, this comprehensive housing plan, right? If we think about poverty, and if we think about the base roots, and if we think about the pyramid, the public health pyramid, and you know, at the top is education, and then in between we have regulation and we have vaccinations and everything. But at the bottom of that public health pyramid that has the greatest impact to better public health is poverty issues and socioeconomic issues. We finally have plans in place that the mayor is rolling out that are all about creating housing and housing insecurity. And, you know, my background, Smart, is environmental public health. I've worked on housing issues and housing insecurity. And I know, you know, there are stories from when we did our Healthy Homes project where there was a family, the child was performing badly in school. Turns out after having them enrolled in our pilot and our project, there was a hole in the corner of the child's bedroom that they shared with other siblings. The property was infested by rats, and the rats would come out at night. The children weren't sleeping. So there's no way that they're going to be able to have functionality in a school setting. So we go in there, we address that housing issue, that critical housing issue. It becomes a safer environment. And these were kids that were also impacted by asthma. So that's how they presented to us through St. Christopher's Hospital. We had a partnership with them. We addressed this opening, we addressed this gap. We also find a leak, we address that gap. All of a sudden, these kids are housing secure now. And we followed the kids for almost a year. Now they're having better performance in school. So all of that ties in to public health. The base root of poverty, if we look at it, is having a place and a space to live, having food, healthy, safe food, and having the capacity for water and economic opportunity, right? So there's also a process, and if you haven't gone to a town hall and you are interested in this, I would really suggest that you go to a town hall. The other part of this is creating job opportunities. So there's a plan with CCP in place that basically from high school to CCP to direct city employment, which if we think about, not everybody wants to go to college, not everybody wants to have that opportunity, but there are segues and opportunities for all of that. There's also opportunities, economic opportunities created for small entrepreneurs and businesses to figure out how they can fit in this loop. So I know I'm going kind of all over the place, but I would suggest that you pull up the budget and take a look at that. And that's why it's very, for me, as someone that has been working on public health for 29 years, this is an exciting time to see these plans come into fruition.
And for everyone, I dropped the link to the budget town hall meetings if folks are interested in participating, and I would encourage you. The links are in the chat. So now we're lighting up with hands and questions in the chat. So Jess, I'll go to you next.
Thanks so much. So the old saying is all politics is local, but that very much holds true for public health. All public health is local. And so particularly during these times where messaging from the federal government is sort of contrary to what we know as good public health practitioners and scientists, as you say, what can we do specifically thinking about sort of the vaccination, the MMR rate in Philadelphia? It looks like the incoming kindergarten class in the Philly area is going to be just slightly below what our goal of 95% is. What do you recommend that we can do in our communities locally to try to really encourage, go sort of fight against the messaging that's coming out all over the place?
So it goes right back to what was said earlier. You're a trusted public health practitioner. People believe, based on the work you've done, people in your subset, your group, they believe what you're saying, right? Yeah, the news, there's all of this happening. You know, it's like a tornado storm, right? As public health practitioners, we have to be steady and stable. As the health commissioner, in this amazing opportunity, in this awesome role, on a daily basis, my focus and my goal is to keep us steady, to focus on the work that we are doing, to stay concentrated and focus back on the science, back on the facts, use our trusted networks to say, hey, you know, if you haven't gotten your child vaccinated, you should get vaccinated. And by the way, we'll be well at that, above that rate. 95% rate is great. We're already working on those things, but we have to be steady now more than ever. And it's a challenge on a daily basis. I get up every morning, and number one, I'm grateful that I have a new day. And number two, I'm humbled at the awesome responsibility in this time and space that I have. And I am mindful of that. And on a daily basis, we have to stay focused and we have to stay steady. And we are the trusted sources. People are putting their lives in our hands. And so we just have to communicate. We have to stay, I had someone say to me, well, this time there are no guardrails. And my stock statement has been, we are the guardrails. We are the guardrails. And you know what? We're pretty phenomenal when we all bond together and band together and work together. And so we don't have to yell and scream. There's a lot of yelling and screaming going on. We don't have to do anything grandiose. We just stay steady and we keep communicating out our message in whatever positive capacity that we can.
And I would I would also just amplify that to our students who are on, to our faculty who are on, if there are opportunities in the work that we're doing in our classrooms, that we can be creating practical assignments that help us to communicate out what we're teaching our students, what our students are learning, and share that messaging out. I think the more people who are saying it, it is a larger voice. It is a more, and I think, Palak, what you're saying in terms of it being a trusted voice, I think there's things that we can do to help as well. So I'm going to jump into the chat real quick. So a really important question, and we saw under the Biden administration the work that the city of Philadelphia was doing as we had an influx of immigrants who were being sent to Philadelphia. We saw the city's response to addressing the health concerns of a growing immigrant community. Can you talk a little bit about some of the challenges about being able to access public health resources now, and specifically in the light of the fear and the concerns? We know that we've got large immigrant populations here in the city. If we go down to Kennett Square, can you talk a little bit about what the department's doing to build trust and ensure access? Because we know that the spread of infectious disease doesn't care if you're documented or undocumented.
Oh, absolutely. And it all ties back into the trust, right? So the example that I will use is for our families who have a lead poisoned child, right? First of all, we don't ask. We're providing our services like we've always provided. And that does not change. But our folks that are in the field doing this good work, whether it's at the health centers or our environmental health inspectors or our air quality engineers, or our STI, workers, our staff that are engaged in all of those activities, whether we're going out and vaccinating folks that are in Kensington, none of that work has changed. We are the trusted sources, so they may, and it's just a matter of just reassuring and being there and continuing, right? There's so much fear mongering going on, and there's nothing like 90% of this is just showing up and being there. And like our lead teams, people trust us because we've been working with them. So they know it's okay to it's okay to let them in. It's okay to do the follow-up. And that's the thing that we can do the most. Same thing with, university. If there are trusted networks, we just build off of that trust and we don't let that trust falter.
Thank you. Sol, you had a question.
Yes. Hi, Dr. Raval-Nelson. Thank you for answering my question earlier about some of the challenges with upcoming sort of globalized events like the World Cup. I actually had the pleasure of being in your environmental health class a little while back, and I think something that I've been sort of thinking about in my public health career is sort of looking at people like you who have a place in public health and looking at identity as like a South Asian woman in this field, and some of the challenges and opportunities that you face like through your career, and how you've taken situations and sort of built from them. Um, yeah. And I guess, and sort of like the opportunities that are available to other South Asian women who want to make an impact in communities and community health.
No, thank you for that question. So, thank you for taking the class. I hope I hope you learned environmental public health and the need for it being the basis of public health. So I don't know how many folks know this or not, but I was 8 years old when I immigrated to this country. I came here from India. I spoke no English or very little English. I knew how to spell the word cat, and that was the gist of it. I had some very powerful elementary teachers that believed in me. I had very lofty dreams. One of my first dreams was to be able to take part in a contest where I could memorize a reading book and present it on stage so I could win a prize. And my Miss Kaminsky was her name. My teacher at that time was just like, are you sure? Because on the one side, I was attending math and science, which was great for me. But the other classes, I was in speech classes because I didn't speak the language. I had a hard time with pronunciation and all of that. And she believed in me. I really wanted to do it. And I did it. And I stood on that stage. And to this day, when I go into settings, I am brought back to that to say that if I could have done my 8-year-old self could have done that back then, think of the things that I could do now. And so it has been a challenge. When I started out in environmental health, it was predominantly dominated by white Caucasian men. I was one of 3 people of color, one of 2 women, and it was the civil service system that was an equalizer. It was my education. Education is a great equalizer. When you get your degrees and your pieces of paper, but more so that knowledge and that knowledge base. I always tell the staff when we're hit with something hard, we're smart people. We can think ourselves out of this scenario. Let's figure this out. Let's take a breath. And so having that trajectory, having that when I became director, one of my first priorities and goals was to have the organization look like the face of Philadelphia. And we did that. And that involved going to high schools to recruit and convincing, Black and brown young people that they should go into environmental health, that they can do it. It's not that difficult, if they really have a passion for it. Going to colleges and universities, talking to students, saying, hey, we have a summer internship. Come and check us out. Environmental health is where you want to be, So I have been doing that. I'm also a very spiritual person and have had these amazing opportunities and found myself in places when I was supposed to be there, and the other part of it is just pushing forward. The staff here that are learning me now in these past 5 months, they've learned I don't accept no well. I also don't say no often, which is why my calendar looks like the way it does, but I don't take no for an answer. I try to figure it out. And it goes back to the 3 pillars that I've operated on: integrity, accountability, and commitment. I hold myself accountable to a level, and my commitment. I fell in love with public health my second day on the job as a sanitarian, when I was able to get rid of expired infant formula at a bodega in Kensington. I was on my way to med school, got into Temple Med, decided that I wanted to help people in a more global way. And I learned about this, and I just have been, if you want it, I've done it. There's nothing keeping you from doing it outside of being that relentless, motivated pursuit of achieving. And you'll be surprised. You take that first step and you show up, the rest of it will follow. It has for me.
Great advice. Dr. Jones, you're up next.
Hi, Palak. Thanks for joining
Hi.
us.
Yes, hi.
I have a question that, there's so much uncertainty right now with funding. And, WHYY a couple days ago broke the news of possibly 3 federal grants to the city being lost, COVID era grants, possible loss of contractors. There are a bunch of faculty and staff on the seminar right now, but there are a lot of students as well. Could you just talk about kind of budgeting in this uncertainty and still ensuring that public health priorities can be covered in this environment?
Absolutely. So just so everybody's on the same page, the information that was reported was inaccurate. So that's the first thing. Okay, the grants and the dollar amounts and all of that, they were not valid. So that's the first thing, and that's what we have to be mindful of, right? And this is why it's important to have the connections and the collaboration that Dr. Ibrahim was talking about, and people having the capacity to reach out and say, hey, I heard this. Is this true? What's happening? Are you okay? And vice versa. And so a lot of that has been happening. As far as budgeting and uncertainty, I will tell you, the COVID era and Risa, we've worked together for a while now. It was like overnight, I had to cut $750,000 out of my budget. So what are we going to do? And at the time I was adjunct and I had to toggle to remote and all of, and it's a matter of focusing on what is it that we're trying to achieve in terms of public health, looking at all of our available resources and toggling those priorities, and then figuring out how we secure our budget with other sources of funding. And wherever possible, and back then with the 750, we didn't lay anybody off at that time. Everybody's position was left intact. We had to do some creative maneuvering, and the one thing I will say is that I had some very tough supervisors coming up in city government who nobody wanted to ever work on the budget, so they made me do it. I was the only woman in minority, and it was like, we're going to give her. But those were the experiences, right? And to your question again, sometimes we get strapped with work and we're like, why is it me? And the question should be, why is it not me? And if we take every crisis as opportunity or look at everything as opportunity, so all of those things that I learned at the time helped me to rework EHS's budget to go ahead and address that $750,000 cut. Fast forward to where we are now, same skill sets. The moment we heard the news internally, it was like, let's look at all of this. Let's take a breath. The sky hasn't fallen. Let's look out the window. It hasn't fallen. Let's take a breath. We're in this together. Let's have our discussions. I let the people that need to know. Our teams meet internally, and we start looking at, well, what are all of the resources that we have available at our disposal? Do we need to ask for additional funding? Where can that come from? But we lead with, what are the public health priorities? Who are our most needy populations, and how are we going to keep them stable and whole?
Thank you. So I know we are coming up to the top of the hour. I know we have some additional questions that are in the chat, and I want to be respectful of Dr. Nelson's time. Questions that are in the chat, and if anybody else has questions, if you want to get them in the chat, we will make sure that we download them. And Dr. Nelson, I will follow up with you. And so if there are questions, we will get answers to you. But in the last 2 minutes, I wanted to ask you, what advice do you have for our students? Things that they should be doing as they start their public health careers, or for the whole range of healthcare professionals, our nurses, our PTs, our OTs, our exercise scientists who are on here. What's your advice for this future workforce to get involved in general career advice for them?
Well, number one, 90% of all of this is showing up. Show up. Keep showing up. Keep working. Keep learning. Keep up the work in public health. We don't have to be the loudest voices in the room, but we have to be in the room, and we have to be a voice. We have to keep doing the work we're doing. We have to stay connected with each other. As I always said, you know, we are the guardrails. We have to stay connected with each other. We have to make sure that we're leading with science and facts, that we are protecting those that we, you know, public health is a very rewarding but challenging career path. And we make that commitment. Public health is human rights. We make that commitment to speak for those that can't speak for themselves. And with that in mind, we have to show up. We have to be there for each other now more than ever. And it's okay to say, look, you know, they just did this. We had a rough day, but that doesn't mean that we walk away, right? Because it's not an option. Walking away is not an option. We may need to take a pause and say, okay, let's regroup, but walking away is not an option. And this too shall pass. There will be another day. There will be, and we just have to keep, you know, keep steady, keep strong, and keep doing the good work that we're doing.
Well, thank you. And on that note, I want to say thank you to everyone who came out today to hear the conversation. Thank you for being part of our community. And please join me in thanking Dr. Nelson for being with us today. We really, really appreciate it. Some folks have asked about how to stay connected with you. We will send out some information as a follow-up, ways that you can follow along with what's going on in the health department. And if you, again, have individual questions, please send them on and we will make sure that we get you connected and we get you answers to those questions. So thank you, everybody, and happy National Public Health Week.
And celebrate that. Celebrate public health, everybody.
Absolutely.
Take care. Thank
Take
you
care.
again.
Thank you so much.